So welcome. We're here today with Dr. Bhalani. Hi, doctor.
How are you?
I'm good. I'm good. Your specialty is pain management, right?
We are an interventional spine and pain practice based here in Tampa Bay and across the state in Daytona.
So when you were coming up, that wasn't what you thought or you wanted to do with your life, though, was it?
No, not at all. So, medicine is one of these things that just happens. So we have about 17 cousins in the family, and literally every single one on my father's side does medicine. We really don't know how to do anything else.
17 cousins and 17 medical providers?
17 physicians.
17 physicians. Oh, my gosh. Okay, that's a high bar. So if anatomy wasn't your thing in your family, you might be screwed a little bit.
You made it your thing.
Yeah. What did you think you wanted to do?
So, I grew up and, the Top Gun hero wanted to be an airplane pilot or Air Force pilot at some point. But, medicine was much more realistic of what you could do. So, even through the med school interview, they asked, hey, why do you want medicine? And I said, I don't know how to do anything else. This is what I just was told I'm going to do. So this is what we're going to do.
Yes. Your parents were like, no, that's not the direction you're going at.
Right. Yeah. My father's a physician. His older brother's a physician, sister's husband's physician. So lots of physicians along the way.
Well, that means, though, as a physician with all these different people, they must have all been in different branches of medicine. So you certainly had the world to pick from in terms of your specialty. And so why pain management?
Yeah, so pain management is interesting. I started out my career as, started out doing anesthesia in the middle of my residency. Actually got out of the medical space completely. And I said, maybe I want to do business. 6 months later, I said, no, not what I want to do. Went back into a PM&R residency. Again, fortunate times, always got lucky. Was able to secure a spot right here in Tampa. And then, I wanted to be always hands-on and interventional, smaller surgical procedures, injections, all of that stuff. Didn't want to be in the OR. Didn't want to be a mean surgeon.
A mean surgeon. They're mean, right?
They
don't have to deal with people after the surgery's over.
Exactly. No, absolutely. And I know this other, spectrum. Didn't want to do anesthesia where it's, no continuity care, or internal medicine where, you're literally seeing the patients. It's a lot more laborious, taking care of everything. So hyper focused on interventional pain management, still good hands-on, and getting the continuity care that we want on an outpatient basis. So
pain management nowadays has sometimes a rocky connotation because of opioid stuff and all that. I feel like your focus is to try to move them away from any of that.
Yeah. So we really do. And so one of the big things is, you're right, pain management has had a very negative stigma, and it's because our state for a long time was a little liberal with opioid prescribing. I'm part of the FSIPP, which is the Florida Society of Interventional Pain Physicians. As a matter of fact, I'll be the incoming president this year.
Oh, wow.
And so we were instrumental in saying, okay, physicians can no longer dispense narcotics from their offices. We're going to have rules and crackdowns around how the state actually allows pain management clinics to be formed and so forth. But, I lecture a lot. I ask the audience all the time, and it was last week to a bunch of physical therapists, and I said, hey, give me a show of hands. How many of you affiliate pain management with a positive thing or negative thing? And it's always 80 or 90% for negative, maybe a few with positive. But again, our practice is big focus is restore function, relive life, which that means that, do I care about your pain? Certainly. But do I care about the fact that, do you get back to doing the things you need to do? If it's, one of your clients that's injured, and they have back pain, sciatica, we want to get them back to their jobs, getting back to babysitting and getting back to their kids, whatever they need to do.
I think that's such a different way to look at it, because managing their pain, obviously it's important. But to get them back to doing things that make them feel whole.
Yes, absolutely. And again, it's about a quality of life issue, but more importantly, it's about, listen, once you get into, right? Once you get into a motor vehicle accident or things like that, there's going to be some permanency to that disc herniation, to that whiplash injury. But can we get you back to doing the things you like to do? Are you going to have some pain? Certainly, right? We're not going to make you 15 again. That's not what happens. But, we can certainly, both of us would like to be there, but, we can certainly try to get you back to the things you like to do with minimum amounts of pain. But the reality of it is, if your good expectation is that, can we get you completely pain-free? Sometimes that happens, and you're super fortunate if that happens. But the reality is, let's get you back to doing the things you enjoy.
Yeah, and I would think that if you're not moving and you're not doing the things that you need to do, you get deconditioned, and that would actually be worse to manage pain, right?
Yeah.
Because if you're not in good shape generally, no?
Yeah, absolutely. So we call it, it's a triad essentially. It's a big circle. So what happens is patients get pain, from an injury, cancer, whatever it is, and then they wind up having a limited function or loss of abilities to do things. Then they get depressed. That's when, like you said, the weight gain, the lack of activity sets in. They get more pain because now you're starting this vicious cycle of pain, loss of abilities, altering your mood, pain, loss of abilities, altering your mood. And it just, the key is to snap that as early as we can.
I bet that would have happened a lot in COVID, where people were either confined, or even now with the new workplaces where your workplace is like a place in your bedroom with a keyboard and you're not moving very much. And our watches actually have to remind us, to move around a little bit.
10,000 steps.
10,000 steps. So some of the pain management you do, though, is for cancer patients, I understand?
Yeah, absolutely. And so, we do everything, from your bread and butter back and neck pain to your motor relaxant work comps to cancer pain. And cancer pain becomes very important because you have, let's take a classic example, okay, of pancreatic cancer, right? That it's almost a certain death sentence, and these patients have 6 months or so to live, 95% 6-month, mortality rate. But how do you want to spend those 6 months? Do you want to spend those 6 months miserable and in bed? Or would you rather come see someone like us where we can do things from a celiac plexus block to an intrathecal pain pump and give you 6 months of quality, meaningful time with your family? So it's critical, especially for these people.
Oh, I would think so, especially like my dad passed away from colon cancer, and
I'm sorry.
When they were able to extinguish his pain, which they were for a little while, everything was completely different, obviously, because and you don't want them doped up.
Nope.
I mean, that's no way to spend the last, whatever time, because the time then is invaluable, because you're able to think, you're able to function, not just for yourself, right, but for the memories that you leave behind for your children, because you're able to have meaningful conversations that your children will remember forever.
Yeah, absolutely.
So it's a gift, I think, what you all do for those people, not just to them, but to their families too.
Absolutely. Yeah, 100% agree. And if you're the patient, you want your cognition to be clear. If you're the family member, you want that person, and you want that last second with that person that you can get with them being who they are.
With them being who they are. That's 100% true. So now you're being very involved in listening to people with pain and all this. How difficult is that from a work setting then to transfer that to your house? How difficult is that to sort of not de-stress but to change your demeanor, to change your mindset when you go home?
It is tough. Pain. We joke with some of our employees and our higher ups and executives at the company. We say, in order to do pain management, you gotta have some thick skin, right? So if you're a primary care doctor, people come to you for a routine blood pressure check, or hey, I just need to get my colonoscopy done, and please schedule it for me. For us, it's every single patient comes to us with complaints of pain, complaints of pain.
It must be like the high anxiety, all of them, or
yeah. And then you don't act, the same when you have a high amount of pain. I don't act the same when I have an amount of pain, right? We're crabby. We're no fun to be around. And so, you have to have thick skin, and you got to find a way to turn it off when you get home. But it does make you, you have a lower threshold for complaints of pains when you get home. But you got to be able to
if I was your child and I had a pain, I don't know. I guess you'd have a little sympathy for me, but maybe not.
Yep, no, absolutely. So, I have a lovely wife and, 3 boys that are all in elementary school, and they come up and they're like, "Daddy, my knee really hurts." I'm like, "Suck it up. You'll be fine."
Because you've been listening to people all day long who are in tremendous pain. Yeah, I think it would be tough on the one hand not to feel, not cynical, but you can't fall apart every time somebody comes in. Obviously,
right.
You have empathy, and then to move out of that zone.
Yeah.
Just in life when you get home.
Yeah. And you got to still, obviously, you still want to be empathetic at home, and you are, but you also can discern, okay, what's a real issue and what is, hey, it doesn't need a crisis, management right now. You'll be just fine tomorrow morning. So, for example, our son twisted his knee last week before we were flying out of town. And, again, the beauty of being a physician is we backdoored him into the orthopedic office where our friends was
Connections,
nice enough
baby.
connections. Nice enough to get a quick knee x-ray, and he did the same thing. He's like, you'll be fine. And he's like, well, will I be fine before I go to Busch Gardens on my field trip today? And
That's what's important to him.
exactly. So that's all that mattered, right? So you understand, like, yay, okay, you'll be fine, but today he's running out of Busch Gardens.
Well, and they seem to heal, a little quicker than some of us who are not.
Yeah.
How old are your kids?
11, 9, and 8, all boys.
All boys. Wow.
Definition boy household.
That is a boy household. And your wife must be a boy mom for sure.
Yeah, she's a saint. We try to break things all the time in the house, including me. And, I'm the fourth child, so she has to yell at me often.
Oh, my gosh. I can't even imagine what the movie selection is over there.
Top Gun, Godzilla,
there you
sports
go.
movies.
Are you all watching Ted and Foolishness? Like, oh, no, they're too young.
Yeah, they're
Wait,
all too young.
wait.
Yeah, they're too young. No, we're big believers in no devices early.
Yes,
And
yes.
keep the PG-13 stuff even away if we can.
Yeah.
But our stuff, definitely not.
Yeah, there was no killing on whatever in my house. When I have a son that, well, I shouldn't say that because my daughter liked to kill people too. Whenever they went to other people's houses, that's what I would find them doing because it was forbidden in my house.
Yep.
Until they were older, and then I had to choose between they stay at somebody else's house and do that, or they stay here and they invite kids over.
The lesser evil is your house.
The lesser of the two evils.
You get to see them in your house, and you actually still get to be like, okay, well, that was appropriate, and that wasn't.
Yeah. So now, when your kids are a little older, I mean, will they be physicians? Is that the way it's going to go? Or what would your hope be for them?
I don't know. I don't know. Like, for me, it was do medicine. For us now, I think we are, fortunate because my grandparents worked hard, my parents worked hard, my wife's parents worked hard, and we work hard. And so we have the luxury of not pushing them to do something.
It's good and bad, right?
Yeah, it's good and bad. I almost tell them that, hey, it's going to be more important for you to stay grounded than it is almost educated. And the reason is because we've worked this hard. Don't take this work and the privileged life you have and, think you're better than anyone. Work hard, certainly do what you want to do, be the best at whatever you want to do. Now, are you a garbage man? Great. Don't just be a garbage man. Go own 50 garbage trucks and do your own thing. But I'm okay with them doing, whatever they want to do as long as they're going to work super hard at it.
And for them, there's a certain lifestyle that they've been lucky enough to enjoy because everybody's worked hard, right?
Certainly.
So they'll have to figure out on their own, and they will, that unless they work hard, that lifestyle is not available to them.
Oh, yeah. And we have that
right? I mean,
with them daily.
Yeah.
Like, hey guys, we're having a sushi dinner. You know why you're having a sushi dinner? Because you and mommy work really hard. Yep.
Right now it's just sort of rote memory to them or blah, blah, blah. But, when they leave for college or even, when their brains are fully formed at 25, that's when they'll hear that voice in their head and it'll be there. It'll be there.
Yeah. It sounds like you're a living example of them saying it to you.
Yeah. My son, who I was on top of for years with his studies, is now on top of some of his friends. And I turn around and I'm like, wait, is he just nagging somebody that they should be getting ready for a test? Like, what happened here?
Yeah.
But it says to me that worked, right? That worked. That something
good
worked.
Good parenting rolling into your kid.
Because there's, your career is obviously important and everything that you do is important, but
yeah,
nothing more important than that.
No.
For mothers and fathers. It's not, if you're lucky enough to have both people in your life, for mothers and fathers.
Absolutely.
But, so a typical day, you hear all this stuff, and then are you zipping off to games or what do they do? What do the boys do?
We're trying to teach them golf, of course, but
That's the best thing
definition
ever.
of boys. So they're like, well, I don't understand. Why can't I play football or basketball? Because golf
concussions, CTE.
Yeah,
Sorry.
exactly. So
There was no football in my house.
but golf takes patience, right? And as a kid, You want to do
Yes.
lots of stuff. So, we're super involved with them. We travel with them all the time. We, involve them. Dinners are still at home. Nobody's got
What did you do? Like, did you play a sport, like for physical stuff that you like to do?
I did. So I'm a big skier. I love skiing.
Really?
And so did I play any sports? No, I'm a 5'3" guy. There's just sports eligibility, heights were weren't quite there.
Did they tell me, did you grow up in India until you were 9?
I did, yeah.
So can't you play cricket?
Yeah, we did. So we're actually, funny enough, we're going to the the T20 World Cup, which is a big deal. I'm actually taking my brother-in-law and his dad and me and my dad.
Oh, how exciting.
So we're taking them. It's like the Super Bowl for them. So things they never got to do growing up because they worked hard. Now we're going to pay it back.
Oh, that's lovely. But the boys are staying home.
They're going the next day, Father's Day weekend, with me to the India-Canada matchup.
I love that.
Lauderdale.
I love that because anything that's part of a person's culture, the kids should absorb that, right?
Yeah, absolutely.
It's beautiful. So it makes this place
they
great.
They competitively dance for like a Bhangra, which is like an Indian traditional dance.
So
they competitively dance since they're little, even though they're boys. And I said, initial couple of years was like, why do we have to do this? Now they actually love it. And I'm like, oh,
really?
Yeah, just wait till you get hormones and, you're really going to love it at that point.
There is nothing sexier for any girl or woman than a man that can dance.
Yeah, absolutely.
Come on.
Absolutely.
Well, and the golf will obviously help them in terms of networking later on when they are in business.
Yeah. Again, a big reason why I push that for them.
I told my daughter is an all-sport athlete for years, and I was like, golf, because that's your segue into breaking in to a world that sometimes, is not easy for you to break into.
Yeah. We as physicians cannot work on the golf course, but, so many other fields can, which is a huge benefit that I'm trying to explain to them.
So when I started one of the law firms that I worked at, I was substantially younger and female, and there were no Latin people there at that time in Pinellas County in my law firm. How did I get the confidence of these guys to be able to try a couple of cases that were high dollar? I spent a day with them on the golf course. I sucked, but I was fun. My jokes were good.
Right.
I drank with them.
Right.
And so, bam, all of a sudden, they had confidence in me.
Yeah. It's a huge networking opportunity and a great way to connect with people. When else are you going to be able to go to someone and say, hey, let me hang out with you for 4 hours and meet you?
And sit around and just chat.
Absolutely.
So what about just in terms of, obviously, you've given them a lot of life lessons. I know that you're involved in some charities, right? Your family, and I'm sure that the boys absorb that too. What kind of charities are you guys involved in?
Yeah, so, a couple of things we do locally. I'm a big believer in, support your background, your culture, where you're from, and support the local community. So, we've been title sponsors a few years ago, and we continue to support the Glazer Children's Museum. Brian and Sean are good friends of mine and Seema, which is my wife. So the Children's Museum, if you don't know, it really runs on the support from the community. The ticket sales barely cover anything. So, all of the salaries and overhead is actually, from the fundraising we do for the Children's Museum Gala. As a matter of fact, we'll invite you this year. I don't know exactly the date, but we'll definitely have you guys out. And then when we go back home to India, we actually do a huge donation to their public schools. Are 1,000 kids, 3 stalls for girls, 3 stalls for boys, and that's it. And the bathrooms are outside. So every year we teach them, hey, we're not going to just give, money. That doesn't work. And so they actually go to the schools. They hand out everything from, they fundraise, raise for books and all that stuff here. But we take books, erasers. One of my favorite holidays growing up was a big kite festival. So we donate kites to every single kid. And I make our kids go to their school, spend a half a day with them, and hand it to each kid to see what it's like.
You can tell them that it's important to work hard, and you can tell them how fortunate they are. But what they see when they go back to India and what they see in terms of what other children's experiences are has got to be, I don't know, in a way it's a gift.
Yeah.
Because you really would feel how fortunate you are if you see children who don't have.
Yeah.
And you're involved in helping them.
Yeah, poverty in our country is, not poverty compared to, whether it's Latin America, South America, Asia, India. It's different levels of poverty for sure. And you want them to
the
be
biggest.
appreciative.
What is the biggest? There's the biggest shanty town in the world in one of the cities. I can't remember which one it was.
Probably Delhi.
Yeah.
Yeah.
My children have never traveled to places, where they can help like that. And that's, you try to do so many things as a parent, right?
Yeah, of course.
And there are a couple things you're finished and you're like, it's good, but that's one of the things I regret.
Yeah. No, and again, if I almost feel like it's never too late. Like even now, if you could do it and you take that trip with your kids and say, hey guys, we're going to go to the Far East. But when you go to the Far East, hey, we're going to take this time out. It's easy. Those opportunities are still there to go to that underserved neighborhood there. And it's still, as an adult, I almost feel like, they will remember this and it'll be ingrained in them as kids. But even as an adult, you see that impact and you're like, whoa.
Oh yeah, it has to change you.
Oh yeah, absolutely.
It has to change you. I never traveled to, but growing up in Catholic school, those nuns, they would travel. Mm-hmm. And so indelibly imprinted in my mind are for me, there were videos of children with no food who were served food and flies everywhere and no clean water. It had an impact on me as a film, even as a bratty high schooler.
Yeah.
So imagine going there and identifying with people and understanding what they're going through in a personal way. I think it's a gift.
Oh yeah, absolutely, absolutely. And we're never too old to travel. Well, hopefully we're never in enough pain that we can't travel. So.
Yeah, that's another thing, right? Sitting in the plane and all that.
Yeah.
Tough for people to travel to see loved ones if they can't tolerate a plane trip.
Yeah, no.
So you're giving them a bunch of gifts.
Oh yeah, yeah. And then again, we're fortunate that we can do that, right? That's the most important thing.
Let me ask you this: treating people who are less fortunate in terms of their health. Visiting people who are less fortunate in terms of, not just their health, but their surroundings. When you think about all these, I don't know, sort of heavy experiences that you had, they resonate with you where you say, I'm going to leave my mark this way. Yeah. I know you thought about that.
Yeah, absolutely. And so I think it's two different things. I think, one is from a patient standpoint, we always... the mentality is always the same. Like, hey, you came to me at a certain way. And I think of it saying whether it's the patient, whether it's, your mom that comes to see me as a patient or one of our employees. I think as a practice and as a mentality, we want to leave people. You started with me somewhere or us as our practice somewhere. Mm-hmm. Did we leave you when we left you in a better place than where you are? That's the key. Whether it's and it's crazy, you can take that same mentality and roll it out across the board. So, one of our physicians comes in, starts with our practice, and, they've come right out of training all the way to somebody that's been there for a few years, all the way to your patient. And, we have patients now that they'll come in, they're like, hey, I'm like, I haven't seen you in 7 years. They're like, yeah, because you guys did these injections and it worked well. And, I was traveling with my husband for a while and, unfortunately he passed away, but I really still want to enjoy the time with my friends. And I'm like, great. That's great. But same thing with our employees. Hey, were we able to, you started with us as a medical assistant and were we able to, eventually get you to a place where you're a lot better off? And some of these people leave. And as long as they leave for a better opportunity or, growth in their career, great. We're super happy for them.
That's awesome because sometimes people live by cliches that are like you can't ever reach them or you can get discouraged. But if you can leave people, like you said, in a better place than where you found them, that's not only hopeful and goal-driven, but it's realistic.
Yeah.
It's realistic.
Yeah. And I think they have to have the trust in you to go along with you for the ride, which is a big thing
I would have a hard time trusting anybody who's going to shoot me with a pain medication injection because I'm a big chicken shit when it comes to needles. And I think those needles are probably pretty big, right?
They can be, but it's not, it sounds so good, so cliche, but it's not about the length of the needle. It's about how thick the needle is. And, the longer the needle doesn't really make an impact. But, if you use a big, thick 18 gauge needle, no bueno. That hurts. But, we're, like I said, we're very good. We actually have a partnership with the University of South Florida. So we train the ACGME fellows and the residents as it is. So, we kind of do everything we can to make that patient comfortable. Some of the patients have injections with sedation. Mm-hmm. Obviously, you're having surgical implants done. You're under general anesthesia. So we make it comfortable for them.
I would venture to say that some of the people that you see are in so much pain that they're like, do whatever you can, do whatever you have to.
Yeah, of course. We live in America, right? So it's a society of instant gratification. Fix me now.
Fix me now.
Yeah. Don't worry about the fact that I broke myself over the last 10 years, but you got to fix me today.
Because they need to get back to it.
Yeah, exactly. They need to go back to their pickleball. They need to go back to their job. They need to go back to, whatever it is, right? And so we live in a society that's like that. unfortunately, insurance dictates a lot of the flow of what we do. But when it's oftentimes when it's personal injury, we can actually say, hey, we can expedite your process, which is really nice privilege for your clients, our patients.
It is. It is. Well, thanks a lot. It's so nice getting to talk to you.
Thank you so much.